I'm afraid that some people, it is only business. Nobody's bothered about service. So these people are not going to stay for a long time. They just want to come, earn some quick bucks and go. In dental, people don't have a lot of faith in dental things nowadays, right? I'm okay to increase a little bit if the overhead charges are getting higher. Okay, let me change the career, let me go to another field. Then when I asked her why, most common answer we get is financially we are not secure. Doctors start comparing their friends. Okay, my classmate is earning so much and I'm earning so much. Please don't compare. After 10-15 years, he's done. Maximum 15-20 years. But you as a doctor, you can continue. The more experience you get, 15-20 years afterwards, you'll be top of your career.
Hi viewers, I'm Dr. Prince. Welcome to my channel, Dental Treasures. So we already finished part 1 of clinical management in dental practice. So this is the part 2 of clinical management of dental practice with Mr. Prem sir.
Hi everyone. Hi.
Nowadays, too many corporate clinics are set up every day. So do you think dentistry is business oriented or is it service oriented?
See, I would still want to run my clinics as a service-oriented field. I have always told my doctors, ethical practice. Please don't do anything unethical here. If it's a filling, it's a filling. Don't please go ahead and do any root canals in it. I would definitely not tolerate all these things. So I would still, believe that it is a service. But I don't want to be anybody seeing it without earning or without getting any finances in or without getting any profits. I would not be able to give rents or pay salaries and all those things. So this requires money coming in, right? But I believe that we should not be overcharging the patients, but doing the right treatments. If root canal has to be done, root canal has to be done, right? So these are the right treatments, as I said, ethical practices. So it is service plus it's a business. It should not be only business. I'm afraid that some people, it is only business. Nobody's bothered about service. So these people are not going to stay for a long time. They just want to come, earn some quick bucks and go. Because of few people around, we are losing out on the importance of dentistry and all those things, because patient always thinks that if we are trying to explain them what treatments are there. See, I always tell the doctors to tell the patients that these are the things which is there in your oral setup. This is what it is. Whenever you want to get it treated, you get it treated. It's not only here. Get it treated anywhere you want to. As a doctor, as a dentist, when you're identifying or when you're diagnosing them, it is not one pain they come up to. Okay, you shouldn't be concentrating, that is the chief complaint. You concentrate, you tell them, but also tell them the other things also. He or she should know that there is a small cavity which is coming up, which has to be corrected. Otherwise, that will go to a root canal, and then after root canal, a cap. If give it more time, probably an implant. So why? Correct it in a small thing, right? So if a dentist is told, that is behind the patient's mind. So someday when they are free, let them get it treated. If not here, anywhere else, right? So I still believe in practicing like this. You do the right practices, things will automatically fall in place. But just don't practice dentistry for only earning money. I should be getting 10 lakh rupees in this and that and all those things. Please don't do all these things. Okay, people lose faith in things. Already in dental, people don't have a lot of faith in dental things nowadays, right? So we are slowly trying to educate people around us how important a dental thing is, how important for you to have a good oral hygiene is.
So every year there is inflation happening, there is hike in rent, there is hike in salary, and also there is hike in material charges. So do you think we should increase our treatment charges?
See, like I said, first it is a service thing for me, but I should still see how the overhead costs are going and all those things. So if the overhead costs are going high, then we should minimal. It should not be like too high. minimal wherever we could increase to sustain that increase of materials or whatever it is. It should not be too high a margin also, because I don't believe in overcharging the patients, right? So probably a minimal hike is good enough, which the patients also understand, right? So we used to pay 10 years back something else, and now it is something else. It's not going to be like this for the next few years, right? So things change, and I'm sure they will also understand it. So I'm okay to increase a little bit if the overhead charges are getting higher.
So this happens in many of our clinics. So some of the patients, they do window shopping, and also they compare the rates. So in this clinic is this many charges, in this clinic is this amount of charges, and they come to us and they have a huge argument and discussion. So how do you handle such cases?
See, sometimes here in celebrity spines also we have undergone these things, right? Single chair clinics, or a doctor who's doing everything. They're not getting in specialists or consultants to do all these things. So he or she can charge lesser because they are doing everything, which I still feel is not the right thing to do, right? It should be more like a specialist based practice. Only if the doctors are experienced, fine, right? The doctors know how to treat that, and they've been doing it for quite some years, is fine. I'm not going to say that a BDS or a normal dentist cannot do all the treatments, but he or she should be well experienced in all those fields even before handling such cases, right? So when it is more like a specialized based cases, obviously the overhead costs also are a little higher for us, right? Because we are giving quality. So when we are giving quality, the patient also should understand that the rates also will be a little more than what the normal clinics charge. If we are giving good materials, in materials itself there are different things. In labs also there are different labs. One of the best labs which I know is DentCare. So they charge exponentially high. So if you want a good quality cap or good quality prosto work, we need to send it there. So that is where our costs increase, because I don't want to compromise on quality. Because the patient has come, visited us, paid some amount. I want her or him to be satisfied with the treatment, right? With whatever we are giving. It should not be like we have given some material which is not good at all, and it just comes off, or it chips off, or it breaks. I'm not saying that good labs it doesn't happen, but the frequency is very less, right? But the other normal labs, the frequency is more. So we as I said, in dentistry, at least in celebrity spines, we always try to follow quality work. Make sure we give the best of things to the patient so that they don't have to keep coming back to us. So there we have to increase the price to just sustain these overhead costs.
Do you think patient gets convinced to start the treatment?
See, I don't want to use too much of corporate words like things. See, if somebody wants a Nike shoe, they will go to a Nike showroom. Then they know when they go to a Nike showroom what is expected there, right? So when you need quality treatment, you need to be expecting the prices also to be a little higher, because to give that there are so much of overhead costs for us also, right? So I would not want to, as I said, I don't want to make it as a corporate thing, but if you are giving a quality thing for us, it has to be a little higher. So the patient should understand this, and most of the patient understand this. I at least 9 out of 10 people have not questioned me. One person will always question wherever it is.
When do you think is the right time for a dentist to expand?
You've opened one clinic. If you're the only person handling it, just stick on to one until and unless you identify somebody else in the same setup whom you can trust to handle another setup as good as what you could handle. If you find somebody like that, then open with him or her, right? So that person dedicates themselves there. So once one person invests, they dedicate themselves there. Otherwise, yes, as I said, I'm lucky enough that I've got employees who are dedicated, but not everybody are like that, right? So I would always suggest to try to make them invest something so that they can dedicate, and then you can open a clinic. For that, you should believe in that person, that person, whoever is there, he or she would do the same justice what you could do in this particular setup, and probably grow or improve the clinics.
When do you think is the right time for a dentist to retire?
Okay, it's a tricky question. Probably the other day I was just talking to one of a doctor who's just started a journey here. She also wanted to quit. She said that, sir, I was not very keen on continuing with this and all those things. A lot of my friends said negative things. Why don't you change your field and go this side, go that side, and all those things. So I felt bad because, as being a non-dentist myself, I'm so passionate about this and I want to continue these things, right? Till now, I regret, why am I not a dentist? Earlier, when I was studying, my father used to always keep telling me that, you have to become a doctor. But I didn't at that time. But now I'm regretting, why didn't I become one? If I would have become a dentist, there's so much of nice things. And I see a dentist, I feel jealous about them, right? So I don't understand why dentists are thinking like, okay, let me change the career, let me go to another field. Then when I asked her why, then most common answer we get is, financially we are not secure. Not everything is finance, right? Being a doctor is another thing at all. You will not get that. You go into engineering, you will earn like 10 times more than what you're earning. But the kind of work they give, slog, the pressure, everything what an engineer goes through. Every time, initially the doctors start comparing their friends. Okay, my classmate is earning so much and I'm earning so much. Please don't compare. After 10-15 years, he's done. Maximum 15-20 years. But you as a doctor, you can continue. The more experience you get, 15-20 years afterwards, you'll be top of your career. Right? So I feel there is no retirement until you feel, okay, fine, let me call off my day. That time also, I'm sure you would take a probe or a mouth mirror if anybody has a dental problem. So I don't think so there is retirement for dentists or any doctors.
As a fresh dentist, they would like to set up their own clinical practice. But you see dental clinics in each and every area. So do you think the market is saturated?
Yes, there are corporate setups. There are the money flow is a complete different thing itself, right? The inflow with angel investors and a lot of inflow is coming in. Let us not compare ourselves to them at all, right? They are in a separate thing. Still, I would still go to a dentist who's a single child, or a dentist who's there near my house somewhere, whom I trust, right? So I would still recommend a person, please open a clinic, gain the trust of all the patients around you by doing ethical practices. That's why I keep repeating this ethical, which is very important. Like, even I have started all these things because keeping myself or my family members in that place, saying that, okay, if we go to a dentist, if somebody does this, then what? How will our reactions be? How would we expect a dentist to treat us? So that is how have been running these things. And I would also recommend all the dentists to start thinking like this. Don't think that, okay, how can I compete with this person, that person? Things are growing. 10 years back, the population was less. 10 years afterwards, the population is this. After this, we don't know. So you don't think as anybody is a competition. You want to open a setup, you're confident of something, like I've told you with the previous answers. See all those things and please go ahead. Don't hesitate with that.
Mr. Prem, do you have any message for our viewers?
See, I don't want to just say dentists in particular. I would say anybody, any fields you're in, probably medical or any business or anything you are doing. So anything, when you're setting up something or doing something passionately, please follow your passion. Don't give hopes very easily. Have some patience. Work hard. Work sincerely. You will bear fruit. This is my assurity. In any fields I'm talking about. Don't lose hope at all. Okay? And once again, I've said, I'm proud to be in a dentistry field where we are, at least thousands of them putting a good smile on them. I think, every dentist should be proud of being a dentist because we are putting a good smile on them, on a patient.
So Mr. Prem is very kind enough to help you guys to set up your own clinical practice. So I have included his number in the description. So do message him if you have any queries. I request all my viewers to like and subscribe this channel. Please do share it with your friends. We've taken a lot of effort for this. Do check out the links which is given below for job opportunities, for sale of old clinics, equipments, and so on. Thank you so much. I'll see you in the next episode.